So I'd like to acknowledge the traditional custodians of the land on which we are meeting tonight. And I'd like to actually read our WWG acknowledgement that we developed actually with an Indigenous Health Service. We wrote it together, and it's very meaningful to us. World Wellness Group acknowledges that the space we occupy and the place we conduct our work has and always will be the traditional lands of the Turrbal and the Yagara people. We understand that the connection between this land and its Indigenous people has a special and spiritual significance that benefits social and emotional well-being. We pay our respects to the elders past, present and future of this ancient land and recognise that delivering equitable healthcare requires that we understand, appreciate and reflect our respect for Aboriginal and Torres Strait Islander peoples. We commit to growing and nurturing our relationship with Indigenous Australians, to assuring their rightful place in the journey that is better health outcomes for Australia, and to exploring the opportunity for partnerships and collaboration to benefit all. So I would like to acknowledge all of you in the room tonight, and especially our patrons and supporters who are sitting towards the front of the room. Our patrons are a really remarkable group of people who have supported us and continue to support us, both financially and also by coming to events like this. So this is an opportunity for us to say thank you. And I'd also like to acknowledge the amazing Joe Kelly, our local state MP, and Terry Butler as well, who's been a great supporter of WWG all these years. So thank you so much for coming tonight. We really appreciate it. I'd like to put in a plug for being a patron. If you'd like to be a patron, go to our website and click on the Contribute tab, or come and see me afterwards. Sorry, I should stop moving. Sorry, sound technician. Okay, so let's talk about tonight. So tonight has two main purposes. The first purpose is to shine the light on some of the structural inequities in our health system, and that's what our main panellists are going to be talking about tonight. But before we get started with that, we would also like to shine the light on some of the issues facing us right here in Brisbane, and that is particularly involving our asylum healthcare program. So, as I mentioned earlier, I'm one of the co-founders of World Wellness Group, and 10 years ago, when 5 of us health workers decided to found this organisation, we did it because we saw that there were huge gaps in the health system. So we thought rather than standing by and watching the gaps getting bigger, we would do something. We had no capital, but we had lots of social capital, and with that we founded World Wellness Group. And to tell you the truth, we actually got into service delivery a lot sooner than what we had planned. And the main reason for that is because at the time, the sector in which we work was really searching for pathways for people seeking asylum to access healthcare. So we threw together a makeshift clinic, we did some crowdfunding, and that's how we started World Wellness Group in our own clinical space. That was 10 years ago, and I have to say that, you know, after 10 years, not a lot has changed for the plight of people seeking asylum. And it's one of the main reasons why we are fundraising tonight, because it's actually quite a serious situation for us at World Wellness Group. So at World Wellness Group, you know, we see a really diverse clientele. For our last count for the last financial year, we had seen people from 118 different ethnic backgrounds, so that's really diverse. But I have to say that the group that probably has the most complex and urgent health needs would have to be people seeking asylum. One of the things that we often say is our mission is to deliver health, equity and justice. It's actually really hard to do that when people are excluded from the health system. It's very hard to deliver health justice for this group of people. So The proceeds of tonight, so the ticket that you bought, even some of the proceeds of Dinesh's book are going 100% and directly into asylum healthcare. And that's because the need is so great. So I'd actually really like to introduce you to one of the team members of our asylum healthcare program, just to give you a little bit of a direct flavour of what it is that we do, and why it's such a pressure point and why so important and life-changing. So I'd like to introduce Mehdi to come up and grab a microphone. We actually had planned to have our GP, Dr. Anna, and Jess, our nurse advocate, here tonight as well, but they both have sick babies, so they couldn't make it. But I was actually going to talk to Jess about the kind of a system navigation she has to do, like on a daily basis, for people who don't have access to Medicare. When they come and see us, you know, she has to sometimes spend hours on the phone just to get access to health services, to find cheaper medicines, to get people into pathology, radiology, screening services, urgent dental, you name it. Those things just aren't available for people who don't have access to Medicare. And so that's a lot of what we do. And I was going to talk to Anna about actually how hard it is to treat medically people who don't have access to the system. And for those of you who are doctors in the audience tonight, you could probably really relate to her saying, yes, it's one thing for me to see people, but then what happens to them once they walk out of the door? It means that, you know, they can't afford to get a blood test even though they really need one. And that's where then Jess comes in, who then has to get on the phone and search for access for people. So we can't have that conversation, but we can talk to Mehdi, who is a caseworker in mental health, and he works only with people seeking asylum, and he's at the coalface. Mehdi is probably the expert, I would say, in World Wellness Group when it comes to understanding the social health issues. So all these social health issues such as poverty, homelessness, drug and alcohol issues, you name it, you know, finding food aid, it's what he does on a daily, violence, that's right. So Mehdi, maybe you could talk to us a little bit about what a typical day looks like, but also maybe what would really help your clients.
Sure. First, thanks for having me. I wish actually my colleagues Jess and Dr. Anna were here because our doctor is doing an amazing job. I'm going to take advantage of this situation and say thank you to Dr. Graham, Dr. Azadeh, Dr. Deepak, because our doctors not just normal GPs, because a part of my job for emotional support, I go actually with my clients to their kind of appointments, and they are working as a counselor, GP, caseworker, and they have to provide all the support. So I just wanted to thank you for the amazing job that you're doing for our clients. But getting back to your question, I think to answer your question, it's better to have a better understanding of the clients that we are working with. Basically, the majority of our clients, they've been detained for almost 10 years. And after that, when actually they were allowed to come to the community in Australia, they basically had no visa, so no work rights, no study rights, and because they don't have any work rights, the financial issues is the main problem, and they don't have access to any health services. So sometimes we think just not having access to health services is the main issue so the person can see a doctor or get the medication. But actually it's the side effect stories that happening around the problem of not having access to mental health services which is the main problem and the unnecessary actually issues that we're dealing every day. For example, a person has been here for 10 years. They have been experiencing and the worst thing that can happen to a human being back then in their origin country. But the last 10 years, it hasn't been a really welcoming kind of situation for them as well. So they've been through a lot, and then after that they wanted to have a better life. No job, no study, and basically it escalated everything to have like different form of the mental health issues besides all the health issues that they might actually have. And when they actually reaching us, because of the limited of the budget and the services, we have to kind of just stick to the eligibility criteria and if they are eligible or not. But actually, it's a really tough call to tell someone that actually it's in need of the medication or, I don't know, other type of any medical related services to say no.
So I'm just going to quickly jump in there. So for people who don't know, so we literally sell raffle tickets to be able to buy medications. So, you know, if you don't have access to Medicare, it means you don't have access to the PBS, and it means you're paying full price for medications. So that's what the proceeds for tonight is going towards, so that, you know, to give, you know, to make it a little bit easier for Jess and Medi to be able to say, okay, we can afford medications this month.
Absolutely. And now imagine like those people came here and now they are linked with the ASRA program, Asylum Seeker and Refugees Assistant, which actually it's providing the basic needs of a human being, even not the first hierarchy of Maslow. You know, actually it's the basic needs that they are kind of having access to. And when actually they, sorry, I get sometimes emotional when I'm talking about my clients, but they need our support. One example, the person is here 10 years, no access to any health services, no job, no study rights, and he was a normal person actually, but now he's having suicidal ideation and he has attempted like a lot of self-harm. And I got a phone call, he needed his medication. I said, actually, that's crazy actually, because we're checking our kind of budget and like every month we check and it's already overspent. So we have to make some really hard decision. And then the person asking for some type of medication or, I don't know, medical support, then we have to say no. Or sometimes we have to say, we need actually just to find another resources, just give us a few hours. I got a phone call, 30 minutes later, he was actually suicidal. So I had to go there, just be there. It took about 3-4 hours. And when I actually talked to him, he said, I'm literally sick and tired of begging for my basic needs as a human, which is honestly is not easy to hear every day. And it's the same scenario for every single person of the cohort that we're working with for the last few years.
Yeah, so we have about more than 300 people in the asylum healthcare program. So about 70% of our clients are male and middle-aged. So we're talking about probably a cohort that's got chronic diseases and a whole bunch of comorbidities, mental health and physical health. The other day we were talking about another client, you know, who's diabetic and who has heart disease, and the actual medications he needs costs about $700 a month.
At least per month, yes.
Yeah, so maybe you could explain a little bit about what kind of resources people have.
And because they don't have access to any other type of services, no saving, again, no income, and they just rely on $400 per month. And when I'm saying $400, it includes the rent, all the other expenses for a person. And we know actually, like, it's almost impossible. They usually rent a house like probably 3 bedrooms, 7, 8, 10 people living together, which is not actually the really suitable situation for people with those experiences. One of the other examples of our clients actually is, just imagine actually you're the caseworker here, or you're the nurse here. I'm gonna actually just put you guys in our position. Mm-hmm. And there is a single mom. You know the whole history of the person, has been detained for 10 years, a victim of the domestic violence, one child, and the child had some surgery, and now actually she needs some speech therapy, which is actually not medication. And there is a window, like for example, 6 months, 5 months. If she doesn't get those kind of treatment, she's not going to be able to speak for her entire life. Now you're sitting there again, you're checking your budget. You know actually they're receiving, because it's a single mom, $600 per month, nothing left, and there is no money. All the budget has been already, like it's the middle of the month, overspent. For us making those actually calls, it's really hard, just to be fair towards all of our clients based on the limitation of the budget that we've got. And I'm going to be honest here, like the less than 1 year or 1.5 years, we actually the 3 of our mental health nurse workers, because of their burnout, because of those situations, they actually resign. So it's not just only the effect of our clients, it's the workers as well that we have to face. But if actually we had the budget, if we had the resources, it could be easy. It's like a surgeon with no tools. So that in your job, actually, you've been trained to save other people's lives, but you can't do it. And it's really something that haunts you sometimes for a few days, months, and you're taking those burdens with yourself, and it's easy actually to be burned out in this job. But if we had those services or kind of resources, it could be much easier for us actually to support our clients.
Yeah, so we thought we would just kind of tell you our daily reality, not so that you feel sorry for us, but really just to share with you, because obviously you have an interest in this area, otherwise you wouldn't have come tonight. But this is basically the daily reality of the work that we do at World Wellness Group for people seeking asylum. And to deliver, as I said, health, equity and justice is actually really hard. And the theme for tonight is so relevant for this group of people. So just to kind of finish off a little bit here, just to give you an idea of the impact, I suppose, of this work is that, in the last quarter, our amazing GP team, and, there's some in the audience tonight, provided 359 appointments pro bono. That's like $35,000 worth of pro bono care in 3 months. That's the impact on our service, and that's like $140,000 a year, which is why our accountant Shirley is here tonight. And there she is. So our chair Hamza, who's here in the front, said, okay, the barometer for tonight is the smile on Shirley's face. So if we get some donations tonight, she'll be smiling, and if we don't, she'll continue looking very sad, because poor Shirley is the person who has to balance our budget. So that's really the purpose why we are fundraising tonight and why we do events like this. We are all extremely busy health workers, but we do these events to shine the light on, the reality of this work. And to hope that you would feel inspired after tonight to, subscribe to us, perhaps become a patron. Even, if everyone donates $5, even that would see us through, 1 or 2 months. So it just means that we don't have to stand up here again next month. And so that's really the purpose for doing this tonight, and to also to hear from our wonderful panel. But thank you so much, Mehdi, for sharing some of your thoughts. And is there
I would like actually
else?
to just share another story, because just to show you and let you know actually how much your support is making a significant changes in our client's life. We had a client, he was actually a victim of the DV. He was, his daughter was taken away. He was homeless, and some alcohol and drug issues involved, which is actually common for people coping with the stress and anxiety that they're experiencing. And he was kind of referred to us, and he didn't know about our services. So when he started, actually, the colleague Jess, she did the whole initial assessment, and then we made the referrals to our GPs and other services that was kind of necessary. And while he was referred to other mental health services, because my job actually is the short intervention, I was kind of in touch with him. And in one of our private sessions, honestly, he's a guy taller than me, and he suddenly started sobbing. And I stopped, and I was giving him a few minutes, and I said, I'm curious, what happened actually? Can you explain it to me? And he said, this is the first time after 10 years that I was treated as a human. And it's actually too sad. I don't know, that's sometimes those weird moments that you don't need to be happy or be ashamed that what have we done to other humans, actually, that the basic needs make them feel that they've been treated as a human. Thank you very much. Thanks for having me.
Thank you, Mehdi.
No
Thank you
worries.
so much. Thank you. So now it's time for me to introduce you to our panellists tonight. So it gives me great pleasure to welcome you to our panel. So tonight we have Rebecca Livingston from ABC Radio, Dr. Dinesh Palipana, doctor, lawyer, disability advocate and published author, and Rita Prasad Ildish, who's also a co-founder of World Wellness Group and our managing director. Please make them welcome.
My 7-year-old son said to me last night, "Where are you going tomorrow night?" And I said, "I'm going to see some good people doing good things." I think I'm going to need a better adjective to describe the kind of work that the Wellness Group does, though. And I think also I couldn't quite bring myself to explain to my 7-year-old why this is necessary in Australia in 2022. But it is, and I think I have the opportunity on a pretty regular basis to talk to people who are in positions of power and who have great means and great wealth, and every now and again they will say to me about, you know, a pretty challenging issue or situation in society, "What are you going to do?" Well, this is what you do. And I hope that some of those people get to hear more and more about what the World Wellness Group does. But it began with 5 people, Rita.
Yes, it did.
You were one of them.
I was.
Take us back to the beginning. What happened?
Well, I guess, over 10 years ago, we were 5 health workers working predominantly in actually Queensland Health, Department of Health. I myself was a manager of a specialist mental health unit, Transcultural Mental Health. And I guess between all of us, we were just, expressing sort of ongoing frustrations around what we were seeing in the public health system due to sort of lack of community-based primary health care out there for the people that we were working with, so the multicultural population. And then there was a change of government and the Multicultural Health Unit got defunded in Queensland Health. We anticipated that a lot of multicultural health programs would get defunded, which happened. And we thought we need to do something. So we banded together and always thought that we would be an intermediary sort of advocacy group that would sort of keep fighting the fight for multicultural health. Our wonderful colleagues at Multicultural Australia in QPAS, some of who are here tonight, offered us some rent-free space at the Brisbane Multicultural Centre because they really supported what our vision was, which was, about working on multicultural health issues. And as Marina said, at that time, 10 years ago, we were literally sitting in a space there where every week people were coming out of detention centres and struggling to get access to healthcare. And being health workers, we rallied the troops, and a GP came out of retirement that one of our colleagues met, and before we knew it, we were running a makeshift clinic at the Brisbane Multicultural Centre. And that sort of grew to where we are now. So, we basically, if people had said to us, "Why don't you set up a clinic?" or, we planned it, we would have run for the hills, I tell you. It's been really, really hard work. A lot of red tape, a lot of regulations, and how sometimes we look at each other and go, is this what we really want to do? But because I think at the heart we're advocates, I think that's what got us going, that's what inspired us. We're advocates, and we talk about us working in the health system while we work on the health system, because we can keep chasing our tail doing this work. There are just so many issues that cause these barriers to healthcare for the people we work with, so we need to work on the system as well. But that's really our story.
Dinesh, you've got your own hell of a story. Let me take this opportunity to plug Dinesh's book. It's a fantastic read. It's available tonight. I inhaled every single word of your book. But talk to us about where your story began with the Wellness Group, because that's just a couple of years ago. How did you first kind of come into the fold?
I met these guys, probably 2-3 years ago. And I guess it really resonated with some of the work that I've been doing and my background as well. Oh, thank you. There we go. Is that better? Yeah. Sorry. But it resonated with a lot of things in my life. I often reflect on, this morning I woke up in Gold Coast and I looked outside, I could see the ocean, and I looked at Australia, all this infrastructure that we have, and I had warmth and light and food. And but I wasn't born into that. You know, I was born in Sri Lanka, and if you look at Sri Lanka today, there are people in that country who don't have food, they don't have electricity, they don't have petrol, and they really, really struggle to survive. Some of my medical colleagues over there, they're operating by mobile phone lines. They've run out of paper, so they're drawing their notes while they do operations on the wall and then rubbing it off. So for me to wake up here in this situation I feel lucky every single day. But I also know that there are so many inequities that exist through the world. And then I had a spinal cord injury as well, and I was introduced to the world of disability. And when you bring all these intersections together, people get into some really difficult situations. And so to hear the story earlier about how much it costs to have medication and how much it costs to survive, you know, when the team at WWG reached out to me, I wanted to help and be involved and do what I can. And I think it's really important work.
Rita, take us to the clinic in Stones Corner. Describe a sort of an average day in terms of who's visiting, what kind of help they can get, how that plays out.
Yeah, so we're in Stoneham Street, which is sort of adjacent to the shopping precinct, for those of you who know Stones Corner, in a fairly sort of dingy building, really. But what people say when they come to our clinic is that they feel the spirit of being somewhere safe, and it's got a homeliness to it. And I think that's what we really put at the forefront of who we are, is providing people with that sort of safety. And being in that multicultural space, we talk about cultural safety. And cultural safety means respect and belonging. And a typical day means that our phones are ringing off the hook because the demand is great, and we would love to have more doctors working with us. So anyone here tonight who knows any other doctors who might want to do some extra work, we basically cannot respond enough to the demand. So we definitely are very busy. The waiting room is full of people. As Marina said, we work with people from around 118 different ethnicities, so very multicultural. We will have people who are newly arrived refugees, migrants, international students, Pacific Islander background people, all sorts of backgrounds, but not everyone is there to see a GP, because we work very holistically and we deliver what we call a wraparound model. So we have a lot of mental health support for people as well. And so people come to our clinic, but we also do a lot of work at other locations around Brisbane, particularly in our mental health program. So a typical day means there's a very busy admin team, coordinating appointments, but what we also have in our mental health program is a model where we have multicultural peer support workers working together with our mental health clinicians, and that's how we provide some of that cultural safety that we talk about. Because the number one ingredient, the number one factor in mental health treatment is that therapeutic engagement, being engaged with your practitioner. And if there's a lot of language and cultural barriers, that's a tricky thing to do. And cross-culturally, mental health practice is quite challenging. So we have over 60 casual multicultural peer support workers working with us, of 60 different language and cultures, who work very closely with our staff to provide that support. So, yes, and as Mehdi said, we have people there who have Medicare. If you think about a bulk billing GP practice, that's essentially what we are. That's what we look like. That's the field that it has. But then in the background, there's all this additional work that happens to overcome the barriers. So some of the doctors who work with us say, the access to interpreters that all doctors are entitled to in Australia, by the way, but many don't use, is because we are set up that way. So everything sort of happens seamlessly because we put breaking down those barriers to healthcare at the forefront of how we deliver our services. And so, yes, you'll hear lots of different languages, lots of screaming kids around getting their vaccinations and things like that. So it's a typical busy sort of medical field, but there's a lot of staff who work in the background providing those extra support services that are needed, because we very much understand that a lot of the health issues that people experience are created by social issues. Housing, DV, mental health issues, drug and alcohol issues. So we have a lot of social workers and support workers who work with other agencies, and we work together in partnership to address some of those issues that are creating the health issues as well.
In terms of the volunteer doctors that you have, because it's all pro bono.
So, no, we are a social enterprise.
Okay.
So we essentially, I guess, are a business with a social purpose, and we run as a bulk billing medical centre.
Right.
The people who are seeking asylum who don't have Medicare, they get pro bono support. Yeah.
Got it. Yeah, I'm interested in your view on that, Dinesh, as a doctor who works in emergency in a big hospital on the Gold Coast, and that idea of whether or not doctors have time, capacity and intention to work in an environment like this. What's the kind of the doctor's view on health equality and access?
I think like I guess the broader issue is, right, like we have asylum seekers and refugees come to this country because, when I think back to living in Sri Lanka, so many people desperately want a better life. And they desperately want to be a part of this country, which is like, when I was a kid, I remember just watching movies and seeing Western countries and seeing this place where everyone had a house and a car and all these things. And people are desperate to escape that. So when I was going to school, I went to school with so many poor children, right? They didn't have shoes, they didn't have houses, they didn't have running electricity or water. And they studied so hard because it was the one way where they could get to university and maybe get a job and eventually find their way to a different country, to take themselves out of the circumstances they live in. So people come to this country seeking a better life and wanting to escape some of the violence and desperate things that we saw. And my family saw that too. We were in a war. So Australia is this place of like a fair go, and we want to look after each other, we want to do better for people. So I think equity and health equity is a fundamentally important thing for us as a society, because we've come together, we've had Medicare, we've had the NDIS, we've had all these things that we invest in as a nation. So I think everyone needs to have access to it. But the health system's under a huge amount of pressure. I work in the ED, I work in the Gold Coast Emergency Department. It's the busiest emergency department in the country, and it's under so much pressure at the moment. There are lots and lots of patients waiting. There are also some mental health issues. The amount of pressure is significant, and when we talk about some of these issues, like say, getting an interpreter or finding extra time to provide better care for the kind of patients that the WWG looks after, sometimes it's just not feasible, and a lot of things slip through the cracks. So it's really important to have something like this where people can go to and get that added care that they need, and to get the intricacies of their situation sorted out, because it just doesn't happen reliably in the hospital system at the moment. And there are some really harrowing issues too. I remember working, in the last couple of years, I was working one night, and there was a woman who was I think she was either a refugee or an asylum seeker or something like that, and she was involved in domestic violence. She had a medical issue, but separately, her husband was holding her child hostage at home. And she had numerous signs of physical assault, separate to a medical issue. And in the middle of the night, in a busy emergency department, with no social work or anything like that, it was actually nearly impossible to sort out the number of issues that was happening. And I handed her over to the next team that was coming on, and I don't really know what happened to her. So to have a place for people like that to go is really, really important. And I think as a doctor, the reason I became a doctor is so I could do something for people just with what's in my brain. And I think medically we have a real opportunity here to impact people's lives.
Rita, what happens when that doesn't happen? When people don't get the care that they need? What's the impact of, those barriers, be it cultural or linguistic or access or financial? What happens to a person's health, either physically or mentally?
I think there's lots of impacts, but ultimately, this negative health outcomes, it's actually going to cost the public system more. I think when I spoke before about my own experience as someone who's worked in healthcare for a long time, and I worked publicly, my frustration was seeing people in psychiatric units and so on who actually, all of that could have been prevented if there had been the right services in the community. So, and that was, I guess, that spurred me to get involved and be part of setting up World Wellness Group. So that was just sort of my experience as a manager in that system. But I'm sort of thinking of a woman who came to our clinic who had been in Australia for about 10 years, refugee background. She actually didn't come to see a GP, she came for a mental health appointment. But then when she saw that there were doctors, she wanted to see someone as well. And, we always encourage people to go back to their local doctor and so on. But she was quite insistent because I think she felt really safe. And then, it turned out that she had been going to another doctor for all these years, but her child was the interpreter. And so she had all these women's health issues that she just couldn't talk to the doctor about. And so, at our clinic, she was able to tell the doctor about that. And so that's just one woman who for 10 years walked around with fairly serious gynecological issues that couldn't be addressed because where she went, those doctors were using her children as interpreters. So that's just a common story that happens a lot. And that just highlights, just one barrier. But ultimately, what happens is people get more unwell and sicker. And as Dinesh said, we're in a very overstretched system. So we need to think more about early intervention and prevention and what we do at the front end.
Yeah. Dinesh, do you see some parallels there in the disability sector as well?
Yeah, the thing is, I had this car accident 12 years ago, 31st of January 2010. And I was a medical student at the time, halfway through. When I think back to that, it actually scares me that I had no idea what life was like for a person with a disability until I had the accident. So I probably would have gone about my merry way, graduated, worked as a doctor, without really having an insight into the challenges that people face, the 1 in 5 Australians. So disability it's a hugely complicated thing. There are physical issues that people face which they honestly don't teach you in medical school and into your medical training. There are all the social issues that people face, and these things interact with each other. Access to the community, access to recreation and fitness, access to employment, income, all that kind of stuff. So there's a huge interaction with all those things. And then when you add intersections like cultural and linguistic diversity or whatever other things it might be, these matters get even worse for people. So I work with the Disability Royal Commission today, and we're uncovering so many difficult issues, and we're uncovering so many harrowing stories. And even for me, the thing that I found pretty shocking over the years is that even having a medical background and even having the privileges that I do, I've still run into some pretty difficult situations with my health. So I wonder what it's like for those without a voice, without access to medical friends or legal friends, some who are here today, to navigate some of those issues. And there's a lot of hidden stuff in this society.
Rita, I reckon there'd be a lot of people who would be surprised to know that if you are seeking asylum in Australia, or if you're a refugee here, that maybe you don't have access to the same sorts of medical services as someone else. And some may even think, well, an asylum seeker, well, they come over, the government knows about them, right? Don't they give them houses to live in and you know, resources to use? And in fact, isn't the taxpayer paying for them? Give us a sense of the kind of restrictions and resources that are actually available to the people that you see.
Yeah. So I guess the first thing I want to say, there's a big difference between coming to Australia under the Refugee Humanitarian Program, where as soon as you come to Australia, you're an Australian resident and you're entitled to everything. And there's really wonderful support services that are funded to assist people. I think the issue of asylum seekers, look, asylum seekers have always, you know, there will always be people fleeing situations in countries, and traditionally, you know, a lot of people have come to Australia by plane, but then we had a lot of people coming by boat, and it's been a very punitive sort of policy environment around that, which has created this situation that we're in today. So, you know, people often say to us they're really horrified when they hear about the work that we do, that this is actually happening in our community, because you are right, people think that the support is there. But when Mehdi talked before about someone living off $400 a month, well, that's the reality, and that's because the state government picked that up. The Queensland government actually funded a sort of basic support program where we're the health provider, where people get that basic income support of $400 per person a month. And there are a lot of people, yes, if you don't have Medicare, you don't have work rights, and there's a very complicated sort of visa system where your Medicare is tied to your visa, you have to renew it every 3 months. So we talk about people having interrupted Medicare too. So some people do get Medicare as part of their visa, but then their visa runs out and they have to renew it, and it takes time to get back on it again, and during that time you are without Medicare. So you may actually be living somewhere in Queensland where you've been able to go to your local bulk billing doctor, but then your Medicare runs out, and then you sort of don't get anything. So it's a very sort of complicated system, but ultimately it means that people are being punished. And it's ultimately, that's, I guess, the motivation behind it. And, you know, it's hard not to get, you know, we say we're health workers, we do this for a humanitarian cause, but we can't help but feel, you know, I guess, the cruelty of what people have been through, and making us feel ashamed sometimes, you know, to be in a country that's, you know, created a system like this, that other countries have started to copy, you know, because it's as a deterrent system. So, but ultimately the end result is to make things very difficult for people, so they stop coming here or they want to go home. And then we have a whole lot of people who can't go home because they come from countries where you can't be deported to. And so we have people living in limbo for many, many years. And as Maddie said, you know, people who are losing their dignity because they have to beg for everything. They literally are at the mercy of the charities. And I think, you know, credit to Queensland Government for the amazing support that it's providing, because it's picked up a gap in the community and responded to a lot of the advocacy that's happened in the multicultural sector. But ultimately, it's been 10 years for many of these people, and it's time to get that resolved and let people get on with their lives.
It's the lucky country, the land of the fair go. It's the country that 10-year-old little boy was thrilled to come to. Why do you think, Dinesh, I mean, you're a big thinker, deep thinker about, you know, why people do what they do or don't do maybe what we could do. Why do you think this kind of situation has persisted in a country like Australia, spruiked as the most successful sort of example of multiculturalism in the world?
I think one of the questions that have come up recently, or at least the conversations, right, is around disability and the Migration Act. Because when you look at the Migration Act, and it's a very uncomfortable conversation for people, but it's probably a conversation that we need to have, is that if you look at the Migration Act and if you have migrants with disabilities, they feel that it's a cost to this society. And really, that's the uncomfortable perspective that we're talking about on the other side. So we're looking at whether people are a cost to this society. I think at the end of the day, we are an extremely lucky country. We're an economically prosperous country. And we're a country that's been built on, like you said, giving people a fair go, right? And if we give a fair go, if we give people an attempt at trying for life, I think a lot of people, like my family that came to this country, came because, you know, we were hungry in a way, and we wanted to have a fair go. Like I couldn't access education or healthcare in my own country without bribery and corruption, which we didn't want to be a part of. But people want to be a part of this system. People want to contribute to this country, and I think we just have to flip that perspective, where we see the benefit of adding diversity to this nation, where we see the benefit. Like I have I think one of the other ambassadors of WWG is Munjed, right? And he was a refugee, and look how much he's contributed to this nation. I have a friend that I saw.
You better give us a bit more background on Munjed, just in case people don't know him.
Yeah, so he's an orthopedic surgeon now, and he was a refugee, and he had to come through incredible hardship. So he was in detention for a while, wasn't he? And he had to come out of that, and now he's doing some amazing things in his repertoire. But I'm going to tell you about another story. As a friend of mine, so I have this friend. She just graduated from dental school, and it was. It's this beautiful girl who just kept popping up everywhere I was randomly. Be crossing the road and she'd just be randomly there in some place. I'm like, are you stalking me? But eventually I started talking to my stalker, and she had this amazing story. She was in the war in Libya when she was a kid. Her and her family escaped through a bunch of countries, and in the course of that, her little brother died. Her dad had a stroke, her mum got sick, and they kept skipping through all these countries as refugees and eventually made it to Australia. And her and her brother, they worked and they put themselves through school. Her brother's now a cardiologist, and I met her when she was in dental school. And she was working, I think, 2 or 3 jobs to put herself through dental school. And she finally graduated, and I saw her in Sydney on the weekend, and she says she's now got 3 jobs as a dentist. But her dream is actually to build herself a van and to drive around to rural communities and provide free dental care.
Wow.
And I think, just think, right, if we had, her name's Zena, if we had 1 Zena for every 1,000 people that we take in, like, I think that's value. And everyone has something to contribute to this amazing country that we live in. So I think we just have to flip that perspective from people being a cost to people being an asset, and to adding to this rich country that we live in.
Yeah, Zena.
Yeah.
We get the warrior princess.
Exactly.
Zena the dental van sounds great to me. So Rita, what about you and some of the people that you've come across over the years at the clinic? Are you seeing Zenas? Are you seeing people who have backgrounds as engineers or teachers or whatever? That
Absolutely. As Dinesh said, I think, at the last census, we're now a migrant majority country. The majority, I believe the first English-speaking country in the world that is a migrant majority, which is amazing, right? It's our strength. Diversity is our strength. And I'm thinking about a lot of our team, like we have a staff of about 70, 80 people, and 97% are from diverse cultural backgrounds, incredibly educated people. A lot have struggled maybe with some of the qualification recognition issues that go on for overseas trained health professionals. I talked before about some of our peer support workers. Most of them are actually health trained from other countries. But people come here, and as Dinesh said, take all those opportunities. People go and retrain. one of our admin staff at the moment was a dietitian from Syria. She's currently retraining back into dietetics. She'll be an amazing dietitian, you know, in Australia. And a lot of the kids, the families that we work with, school captains, you know, you look at kids who grab those opportunities and work really, really hard in school, achieve amazing things. And I think as you look at sort of the entrepreneurs in our society and the rich list nowadays, it's becoming more culturally diverse. You know, people are really grabbing all those opportunities and making amazing contributions to our country. And I think that's ultimately what happens. And, you know, I guess we're in the business of healthcare, and there is a lot of untapped resources in healthcare with overseas trained health professionals who have to jump through a lot of hoops and can't get working here. So it's sort of interesting with all the conversations that are happening in the community about, you know, skills and jobs and things like that.
Yeah, it's not like we have a skills crisis, Rita. I mean, come on.
Exactly.
Yes.
That's right.
So actually, and on that note, I did speak to the boss of Multicultural Australia the other day, who I don't think went to the Jobs and Skills Summit, but was there someone there advocating on that front along this kind of line?
So the peak body, FECA, Federation of Ethnic Communities, yeah, so their CEO was there and consulted in the community. So we were part of a meeting that provided input into that and strongly advocated the issues of you know, the workforce that already exists in Australia. You know, we make these flippant jokes about, you know, the Uber drivers and the taxi drivers all having master degrees, but it's the reality. You know, the reality is there's such a wasted talent already in our community if we got that right. And I just look at our own workforce in our clinic, and we're a living example of that. You know, some of our casual support workers are overseas trained doctors. You know, one ran a specialist unit in Paris, but can't work in Australia. You know, just crazy laws that we have that we really need to overcome.
Dinesh, you're a lawyer, as well as being a doctor and an overachiever. Why can't a doctor who was running a unit in Paris work in Australia? What does it take to transfer those skills over?
I was also a fashion model recently.
Oh, shut up.
Australian Fashion Week, yeah. Learning to be a pilot currently. Anyway. Yeah, it's a complicated thing, right? Like, we have all these structures about professional registration, and I had a friend who trained in America at a very prestigious university, became a doctor, and then when he came here to transfer his registration, he had to do the English exams. So I thought that was... I think sometimes we just get so bureaucratically stuck. And we get used to these tick boxes, and I think we just need to start seeing outside of that bit, and probably using common sense as well, right? Because if you're getting an American-born person to, okay, maybe Americans is a different thing, but but to get them to do an English test, I think that you just have to think about the common sense in the way we do stuff. But there are significant barriers for people. And perhaps a period of transition and a period of easing them into our systems is probably safe and sensible, but I think it has to be done with common sense. And, you know, just on another note to that, I was just listening to our conversation and reflecting. You know, we talk about multiculturalism and we talk about all these different things, but I think where the dream is, where we need to get to a point, and I think we're probably starting to get there, is that to understand that actually our Australian culture is diversity. Our Australian culture is having all these different people thriving together, and our culture is actually like a fair go and all these things. So I hope we get to a point where we don't have to have these conversations And rather than looking at black or white or the different things that separate us, we start to celebrate the things that unite us, and where this is not an issue and everyone can access all this stuff.
Do you think that the last couple of years through the pandemic, where you realise just how far and wide people are with connections to Australia, just how many people here have parents in continents all over the world, and found themselves separated for long periods? I mean, I could go on the radio every day and say, is there someone listening who's got a loved one in pick a country? And someone would call in and talk about it. Similarly, the conflict between Russia and Ukraine, which perhaps for a lot of Australians might have felt like that was far away, and all of a sudden we are so impacted by the flow-on effects of that conflict, and it sort of demonstrates the connectivity of the world. Do you think that in a way the pandemic sharpened, and that war sharpens our understanding of just how connected we are, and ultimately, hopefully, that will, I don't know, break down some barriers in terms of understanding the work that you do, Rita?
Yeah, I think the world is definitely getting smaller, isn't it? I think the pandemic was a really interesting experience for us because I guess as a health service, we remained open during that time, and actually, a lot of people living in the community on different visa situations, international students, actually were really hard done by during the pandemic. And I think, we talk about sort of our mission. Our mission is about health equity. And I think 10 years ago, when we talked about that, people sort of looked at us and thought, what are you talking about? Now everyone sort of talks about it. And I think what the pandemic also did was really shone the light on sort of the social inequalities in our community. So yes, we are connected, but there's also still a lot of difference and inequality. And I think that certainly since that has happened, we're finding now that there's a lot more openness to want to try and learn about it and understand it and see what can be done about it. So in some ways, having these conversations today is a lot easier than it was when we started 10 years ago, because there's a greater awareness. And I think that's because we became so aware of what was happening. Like, we were sort of watching what was happening around the world because we were behind, but then we could see the disparities that were happening for people who were poorer, the ethnic minorities around the world in countries like the United States or Canada and some of the European countries. And then it started happening here, and I think the stark reality is that most of the people who died from COVID in Australia were migrants, right? So, the statistic is it was 2.8 per 100,000 for Australians, it was 6.8 for, people who were born overseas. But in some communities, like the Middle Eastern communities, it was like 30 per 100,000, right? So we're talking here about massive differences. In fact, every single non-English speaking background community had a higher death rate than Australian-born. Now, that is the most blatant evidence that we have of health inequity. How did this happen? How did we get to a point where we have such damning statistics about the COVID death rates? But I think there's the awareness now. So often when we used to talk in the past about the issues that we're working with around health inequity, people go, what's the issue? Australia's got a great healthcare system. What are you talking about? Because so many of these issues were so hidden. But I think that's a statistic that we can't ignore, and hopefully will open the eyes and get people to really think about what can be done for that not to happen again.
Yeah, that's some shocking figures to reflect on. Tell us a bit about the helpline that you set up during the pandemic as well. Yeah,
so as I said before, when the shutdown happened during the pandemic, because we are a clinic and we remained open, and there were a lot of people in the community who lost their jobs, a lot of, I guess, people from international students, migrants on temporary visas and so on, not having, I guess, the safety nets or the supports that were available to people in the community. So we became a bit of a, I guess, a magnet for assistance. And because we had so many people sort of seeking assistance, we talk about the accidental helpline. We started a helpline in a way to sort of support people, and it sort of grew. So Queensland Health actually ended up funding it. It's been funded until June next year. And I think in the early days, we were really all about giving people the basics. You know, we were working with all the food charities to keep people fed, helping around housing issues, doing lots of education about COVID and vaccines and so on. And over time, it's now become more of a sort of psychosocial mental health focus, because we talk a lot about the shadow pandemic of the mental health issues that happened during COVID, and that's really sort of the key issue that we're working with now, is really all the mental health issues.
Yep. And when's the helpline funded through until?
June next year.
Do you think you'll need it after that?
Can't see mental health issues turning around in the community by then. Yes, Hamza just reminded me also that we actually are part of a national pilot and actually running this nationally as well. So it's actually really expanded Australia-wide. So yeah, WLG is actually working nationally too now at the moment, which is great.
Superb. We let you add into that tonight, Hamza, since you wore shoes for the occasion, okay? So, yeah. Dinesh, just getting back to your overachieving CV, doctor, law degree, fashion model. There's no comedian in there, though, is there?
Not yet, no.
No. But there is a comedian linked to the World Wellness Group who is also an ambassador like yourself, Judith Lucy, right? Did you know that?
No, I did not know that, actually.
I only learned that tonight. So there's you, Munjed.
Dr. Munjed, yes.
How did Judith Lucy get involved?
One of our board members, well, actually, we ran another fundraiser. We had a film night, and there was someone in the audience who was involved with the St Mary's in Exile Church. Yeah, Marina knows more about it than I do. I think she's actually here. Yes. So, Judith Lucy had done a documentary, I believe, and had interviewed people from that church and had sort of stayed in contact with them, and so said, if there's ever anything I can do, let me know. So they offered her up to us, which was amazing. And so she ran a comedy event at Cloudland. But what we learned was that Judith's manager pretty much manages every comedian in Australia. And so we got a whole bunch of really amazing comedians, and we ran a couple of Laughter is the Best Medicine comedy events. Got to have fun too, right? And Joe Kelly got picked on by Judith Lucy at some of these events. I'm sure he still remembers that. So, yeah, you know, we have been very lucky to get support from such a broad section of the community for the work that we do. And I think, yeah, Judith has a really big heart. So she's been a great supporter.
Oh, fantastic. All right, so you don't need to work on your jokes, Dinesh, because that's covered off.
Damn. Yeah.
But what do you see as your role as ambassador for the World Wellness Group? Like, how do you want to talk to people? How do you want to spread the message of what these guys are all about?
Oh, there's so much, right? I mean, we talked about we've heard about the needs that the organisation has. We talked about the needs of the people. And I think there are so many different parts of our society that we can talk to about support, whether it be doctors, whether it be philanthropists, whether it be politicians, whatever. So I think it's just about having those conversations wherever we go. But I think for me as well, I feel incredibly grateful for my life, and I feel incredibly grateful for the position that I'm in today and for the things that I'm given. And I think whenever we are given these things, we have to try and use them for the good. And so wherever I go and whatever position I'm put in, if I can do something to help this work and to help the people that benefit from him, then that's when I try to have the conversation. Actually, recently I had a parking fine, and
Another one.
well, I think we might have talked about this one, but basically, when you have a disability parking permit, you can park anywhere, right? So it's one of the perks. I was with my friend Kurt Fernley, and he said, I think my wife just married me for my parking permit. So I parked in this place and I got a fine, and it turned out that it was a private operator that runs this street. So I fought it, and it ended up in the Current Affair and all this stuff. But eventually they called me and they said, we're so sorry about the way we handled it, and we're doing all this stuff around disability now. We've changed the company, and we want to give $20,000 to a charity of his choice. So I gave him a list, and that those are opportunities to give money as well to causes like this. So yeah, I just take those opportunities as well to think laterally, but whenever I wander around Gold Coast now, I'm the parking guy. So I'm the people's hero for fighting the parking company.
You should just share the anecdote in your book about the fine that you told your mum that you had, and it wasn't in fact a fine.
Yeah, well, I was actually a massive pest for my mum when I was a kid. She has had to come get me from the police station. She's had to do all this stuff, and she's rescued me from so many things. And I used to frequently actually get parking fines and speeding tickets. But when I got into medical school, I handed her the envelope with my letter of offer, and I said, "Oh, I'm sorry, I got another fine. Can you sort it out for me?" So when she actually opened the envelope and saw that it was my medical school offer, she was very happy.
Did you forgive him? Yeah. Yes. So that's the platform at which Dinesh comes at the work of the World Wellness Group, which is brilliant. And, and you mentioned Kurt Fernley, and we see another friend and colleague of yours, Dylan Alcott, even at the Jobs and Skills Summit, touching on some of the issues that we talked about tonight in terms of seeing people as resources and capable. Rita, I wonder what you'd share just to finish up tonight to everyone in the room in terms of how to contribute, how to make a difference and help the work that you're doing.
Sure. I think at the outset when Marina said we started World Wellness Group with nothing really, but we had a lot of social capital, and I think that's what we need to keep building, our social capital, our networks of supporters. And look, some of it is really, down to the basics. As you know, we need funding to do really basic healthcare for people seeking asylum. But we also have really wonderful networks, like a lot of corporate agencies, have supported us in different ways, either through donations or sponsorships. We have partnerships that we work with. As Marina said, we are always looking for more patrons to support us. We need more doctors, nurses, basically the health workforce really working in partnership and supporting each other. So anyone who has any sort of great ideas. Just a really great example is, for instance, law firms. We have a health justice program, which we ourselves fund. We don't have any funding for that, but we really so the need to do that because so many people we work with have really complex legal issues impacting on their lives, which create or exacerbate their health issues. And so, for instance, we have really great partnerships with a number of law firms. We have, lawyers offering pro bono support, but what's missing is actually the staff to do the coordination and support of our clients. So it's just sort of really creative partnerships, any ideas that people have, it's really getting on board. If you go to our website and there is a contribute button, and on contribute, it sort of highlights ways that people can support and contribute to us. So it isn't always just money, it's networks, it's support, it's just ideas to get on board. Working in health equity is a complex business, like it's, as we said before, it's working on all the social issues that create the sort of ill health that people have. It's not just a medical clinic that can do it on its own. It's really about galvanising everyone and working together. And I think just looking at all the people here tonight from so many different sectors, like obviously you all go back to your workplaces, and there's programs like workplace giving, we have a number of organisations that do that sort of thing that help us a lot. But ultimately, yes, it's working together and having wonderful people like Dinesh supporting us. So yeah, it's a team effort, but all of us working together, really.
I think I will tell my 7-year-old it is good people doing good things. Thank you both so much. Thank you very much for having me here tonight as well. And I don't know, do we get to eat, drink and be merry now? What happens, Marina? Thank you.
Thank you.
Thank you so much to the panellists. I hope everyone enjoyed the discussion and the thought-provoking anecdotes for tonight. We'd like to just give a little gift to you, Rebecca, and to you, Dinesh, for being part of this event tonight. My assistant over here is going to bring that forward.
Is it Dinesh's book? Because I've already got a copy.
No.
No, seriously, it's such a good book.
Thank you.
I'm evangelical about it, Dinesh. I was just talking to someone before I came here. I was talking to the producer of Conversations with Richard Feidler. She's retired now. And I said, oh, you got to read Dinesh's book. And she said, we had Dinesh. And I said, I don't care. You haven't heard the whole thing. You've got to read the book.
Okay. Although this gift looks really tiny, it's actually really... because we've all read your book as well, and it'll make a lot of sense to you because of your love of pizza.
Oh, yes. Love it.
So thank you so much.
Thank you.
And maybe, Ashley, you might be able to give Rebecca a little gift.
Ah, thank you. Wow. Thank you so much. Okay, thank you.
We thought you could take that back to either home or the studio, and it could continue to grow.
Yes, yes. Well, my current producer, Josh, is plant obsessed, so he's my plant doctor as well. I'll take it to work.
Perfect.
And I'll continue to grow.
Yes, you will. So, as I mentioned earlier, anyone who's already pre-purchased Dinesh's book, you can pick it up from the table. If you haven't, but you would like to purchase it, please do. It's actually cheaper than the recommended retail price, and we get a cut, so you can help us at the same time, so please. And if anyone would like to make a donation, Shirley will be over at the table as well, and we'll watch her smile grow as the night progresses. If you would like to continue to stay on for a little while and to have a drink, the bar's still open. I'm not sure about the food. It might have been taken away already. I'm not quite sure, but please do stay for a while. Dinesh is also going to be over there. If you would like to have a chat with him and meet him, please do. And I think that kind of wraps up the official part of the night.
Woo.
Thank you so very, very much. Good night.